Are you currently suffering from shoulder pain and weakness? That's worse when you raise your hand overhead or reach behind your back. Hey everyone, this is Dr. Zach Greenwood here, Performance Sport and Spine, and today's video we'll be discussing rotator cuff tendinopathy. The rotator cuff is comprised of four separate muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Then these muscles and tendons kind of wrap around your shoulder, encompassing the top of your humerus in this kind of sleeve, and it provides movement, stability, and motor control. What does this condition feel like? And it most commonly presents as pain on the front and or back of the shoulder and associated weakness, and the positions or movements that are most aggravating are raising your hand overhead or reaching behind your back. It's most frequent on the dominant arm, and is most commonly seen in occupations or sports with a high rate of upper limb loading. This condition presents on a continuum, so some people might have just mild pain and no weakness, and others can have severe pain and marked weakness. Again, there's no black or white here, and it can happen on a scale. And at this point, if you'd please like our video, subscribe to our channel, and then don't forget to turn on notifications. Now I'll talk about what causes this condition. As we age, unfortunately, our tendons get a little weaker and thinner, as well as the control of the shoulder joint gets a little worse. And this can cause irritation to that tendons, and if it goes on for long enough, it can cause degeneration. Subacromial space, where the tendons kind of exit the shoulder. Well, there's that bone on top called the acromion, and some people have it a hooked acromion. So they were told that as they raise their arm up, that bone is kind of wearing out the tendon. But there's two problems with this. So first of all, this cadaver study found that people that were young, none of them even had that hook. It was acquired over age. And then secondly, most commonly the tendon falls apart on the bottom, not the top. So again, the last thing you want to think about is raising your arm is wearing out that tendon. That's not happening. Again, there's some changes that are happening, but fortunately, exercises will not only decrease your pain, but they'll increase the capacity of the tendon and increase the control of the joint. So they're the best treatment that we have for this condition. Shoulder pain is the most common musculoskeletal condition for people over the age of 65. Now I'll talk about some activity and posture modifications to be aware of. Well, first and foremost, try to avoid or minimize the time you sleep on the affected side. Again, this puts too much compression on the inside of the tendon and can stretch the outside of the tendon. So don't freak out if you lay on your side when you wake up, just roll onto your back or your stomach. In addition, reaching overhead or lifting heavy objects over your head or reaching behind your back, such as adjusting things in your car, should probably temporarily be avoided. And again, think if your finger was irritated or cut, you wouldn't want to bend it for a little bit, but once the tissue's healed, you would go back to it. Same thing here. These aren't bad inherently, but we want to probably avoid them to let the tissues heal. This portion of the video will go over the exercises and rehabilitation. For the exercises, there's going to be a raise, a rotation, and a press. From level 1 to level 3, increasing intensity. We want you to pick one of each and then increase independently till your symptoms allow. Front raise, level 1, holding a light weight in the affected arm with your elbow straight. We're going to raise our arm up to about 70 degrees and then return to the starting position. Don't go above 70 degrees and you should feel some tension in the back of your shoulder. In addition, some light discomfort is okay, but the movement should not be painful and you should feel safe doing it. Level 2, with that same weight with our elbow full extended, we're going to raise our arm completely overhead. Pause for a second and then return to the starting position. The same parameters apply as the level 1. And again, we're trying to go full range of motion and you feel safe and controlled, and make sure to get to that 180 degrees by the end of this level. Level 3, with the slightly heavier weight, we're going to raise our hand all the way overhead, normal speed, but on the eccentric or down part, we're going to go slower, 2 or 3 seconds. Now this is going to increase the intensity quite a lot. So you might have to do less reps initially until the tendon can adapt, but it's important to increase the intensity of the exercise rather than going faster. So you want to make sure you're going up, normal, and down, slow. Level 1 rotation. So with your arm at 90 and your elbow about the same height as your shoulder, we're going to put our hand on the affected side, and then through our shoulder joint, not our elbow, we're going to rotate up towards the ceiling, trying to maintain 90. And then come down normal speed. Again, you may have to find that you only do partial range of motion at first, but again, as you do more, you want to feel the full range of motion, and some mild discomfort is normal, but again, it should not be painful. So level 2, laying on your affected side up, we're going to have a light weight with the arm at 90, and again, putting your hand on your shoulder, we're going to rotate the weight up towards the ceiling, feeling that dull tension, and then back down. Again, make sure to feel the tension through the shoulder and not the elbow, And this is going to increase the difficulty a lot, so you may have to decrease the reps initially and then progress over time. Level 3. With the same weight, we're going to fully straighten or extend our arm and then swing our arm up to the ceiling, rotating the top, and then do a slow down or eccentric for 2 or 3 seconds. Again, this is going to increase the intensity of the exercise quite a lot, so you may have to do less reps initially, but make sure to keep the intensity high so the tendon can adapt and get stronger. Pressing level 1. With about your feet a foot away from the wall, we're going to do a push-up against the wall. So place your hands on the wall and then press out and in. To increase the difficulty, walk your feet out away from the wall, and again, some mild discomfort's okay, but it should dissipate within 30 minutes of the exercise. Level 2, knee push-up. So laying on the ground, we're going to get up into a knee position for a push-up. And then we're going to lower down as far as you feel controlled, and then return to the starting position. Initially, if you need to reduce the range of motion, that's fine, but again, work to increasing the full range of motion, and then progress to the next level. Level 3, push-up. So laying face down, we're going to press up into a push-up position, and then return to the starting position. Now again, if this is too much initially, you can start from the top and then just go halfway down, and then return to the top and build up strength that way, and then over time you can increase the full range of motion. But again, the goal is to increase intensity on that muscle and tendon. What are the risk factors for this condition? Extrinsic factors, so muscle fatigue, tendon swelling, and then perhaps reduced subacromial space, but this probably needs more research to be definitive. Intrinsic would be aging, genetics, vascular changes, and altered loading patterns. And then lastly, lifestyle, obesity, metabolic syndrome, smoking, and antibiotics, most specifically fluoroquinolines. Now we're going to talk about 5 themes of daily experience that people with this condition suffer from, and there's a good chance you can relate to this because this can be quite frustrating. Number 1, frustrated due to their sleep being regularly disturbed. Number 2, hard to work, especially those with manual jobs. Number 3, disturbed about being unable to do meaningful activities with loved ones or friends. Number 4, feeling frustrated that the exercises they were given caused pain and not adequately understood the difference between hurt, which is irritation, and harm, which causes damage. Lastly, feeling that there's a lack of direction or progress in their rehabilitation. Lastly, we're talking about this concept called central sensitization. So with this condition, people's pain levels can be really variable, from really mild to truly debilitating. I've had some patients that really their life has been stopped because their shoulder hurts so much and they feel weak and scared. Well, what's causing this to be so painful in some people? In a nutshell, what central sensitization is that when there's a painful stimulus to your nervous system that happens repeatedly until the nerve cells memorize that sensation, so the next time that painful stimulus leaves a more increased pain level. So if it starts out at a 3, it can work up to like a 7 or an 8. Thank you for watching our video on rotator cuff tendinopathy. If you found it helpful, please like the video and subscribe to our channel, and then don't forget to check out our other videos.